Hi, my name is Benjamin Stanley, and I consent to a head, ear, eye, nose, mouth, and throat exam.
My name is Jessica Stanley, and I will be conducting a head, ear, eye, nose, and throat exam on Benjamin Stanley for exam number 1, Nursing 650 Advanced Health Assessment. Hi Ben, my name is Jessica Stanley, and I will be a nurse practitioner. How are we doing?
Doing good.
Good. So we conducted our general survey, and everything's within normal limits. Your vitals are good. You're well appearing. You're 5'10", 220 pounds. No recent illnesses.
Nope.
Okay, so let's start with a skin inspection. Can I see one of your hands? Great. So it does look like your skin is nice and pink, warm, and dry. Hair is evenly distributed. No clubbing. Good capillary refill. Looks like you have a lot of tattoos. They do look like they've healed well. There's no scarring, no infections. Same thing. Let me see this hand. Okay, great. Smooth in texture. No suspicious lesions, moles, or ulcers. I do notice a couple freckles. They're less than 5 millimeters in diameter. They're brown. They're flat. They're symmetrical. So moving on to your hair, you look like you have some male pattern baldness on the top, receding hairline. Otherwise, the hair is thin and well distributed throughout the back. The facial hair you have is thick and coarse, evenly distributed. Eyelashes and eyebrows look like they're well distributed. Can you do me a favor and raise your eyebrows? Okay, great. Now close your eyes really tight. Don't let me open them. Great. Smile. Give me a frown. Puff your cheeks out. Okay, great. So I am going to palpate your skull, okay? So let me know if you have any pain or tenderness. Have you had any recent headaches lately?
Nope.
Okay, great. Okay. Just a little dryness there. Okay?
Mm-hmm.
So what I'm going to do is I'm going to test your visual acuity. So why don't you go ahead and read the smallest print you can read with one eye covered.
LTFPH.
And with the other eye?
LTFPH.
And with both eyes?
LTFPH.
Any recent visual changes, visual disturbances?
No.
Okay, so I just want to check your pupils. Your cornea, okay? Okay. Great. Your pupils are both direct and consensually constricting, and your cornea looks great. Iris looks good. I'm going to take a look here. Pull your eyelids down. Okay. Any pain here?
No.
Okay, great. So what I'm going to do now is I'm going to take a look at your visual fields. So I'd like you to cover your left eye with your left hand. Okay. And tell me how many fingers you see. Look straight at my nose.
2. 1.
Look straight at my nose.
2. 1.
Okay, now cover your other. Okay, tell me, look at my nose. How many fingers?
3. 2. 1. 2.
Okay, great. So now what I'm going to do is I'm going to check your eye muscle movements, okay? Look directly at my pen light and just follow it with your eyes, not moving your head, okay? And follow my pen light into your nose there. Great, okay. Alright, so now I'm just going to have you look straight ahead at me. See your red reflex. Your blood vessels look good. Your optic disc looks good. And I see your red reflex. Okay, great. Okay, so I'm just going to feel your ears, okay? And you're going to let me know if you feel any pain or tenderness. Any hearing problems recently?
No.
Okay. Any pain here?
No.
Any pain here?
No.
Okay. Okay, So I want you to occlude your left ear there. And I'm going to say a 2-syllable word, and then you tell me what you hear.
Apple.
And your other ear? Cover that ear for me.
Baseball.
Okay, great. So now I would like to check for lateralization. Tell me if you hear this on one or the other or in the middle.
Middle.
Now look to your right there. Okay, I'm going to put this on your bone, and you're going to let me know when you stop hearing it.
Yep.
When you stop hearing it, you let me know.
Yep.
Okay. You're going to do the same thing on the other side, okay? I'm just going to put this right on your bone. Take a look to your left. A little bit more to your left. Let me know when you stop hearing this.
Yep. Yep.
Okay. I'm just going to take a look inside your ears, okay?
Okay.
So if you wouldn't mind, let's turn you this way. So I am going to pull your ear up and back. Okay. I'm just going to take a look at your canal and your tympanic membrane, okay? Okay. Looks good. Now, let's go this side. I'm just going to pull your ear up and back, okay? Back. Okay, great. So I'm going to have you face me. A little bit like this. Okay. Looking at your nose here, okay? It looks nice and midline, no deviations. I'm going to palpate it here. No polyps. I'm going to palpate here. Do you feel any pain or tenderness?
Nope.
And what about here? Pain or tenderness here?
Nope.
Okay. Now I want you to cover your left nostril. Take a deep breath in. Okay. And the other nostril? Okay, a little congestion there. Close your eyes. Cover one nostril and tell me what you smell.
Banana.
Okay. And we're going to do the same thing on the other side.
Apple.
Okay, great. So now I'm just going to take a look inside your nares to make sure that they're patent, there's no ulcerations or any concerning findings, okay? Okay, so turbinates are a little bit red and inflamed there. Otherwise, your septum's not deviated, you don't have any polyps, okay? No concerning findings there. So now I'm going to take a look at your mouth. Any gum bleeding recently, any tooth pain, cavities, anything like that?
Nothing.
Okay. So I'm going to take this here, just so I have it. Okay. So your lips do look a little bit dry and cracked. I'm going to just take a look at your gums and your teeth first, okay? And I'm going to take a look on the inside. So I'm just going to take a look at your cheeks first, okay? And the top of your mouth. Cheeks. Just going to pull this lip back, okay? Now lift your tongue up. Alright, now I want you to say ah really wide. Say ah. Really wide there. Okay, great. Your uvula looks like it raises. Your tonsils look a little bit red. You do have some postnasal drip back there, but everything is symmetrical back there. Now, if you wouldn't mind just sticking your tongue out for me, I just want to palpate it and make sure there's no masses. Looks nice and pink and smooth. I don't see any ulcerations or white patches. So do me one more thing with your tongue. I want you to stick it out and wiggle it to the left and the right. And now touch the top of your mouth there. Great. Okay, so now I'm just going to take a look at your neck. I'm going to inspect and palpate your trachea and your thyroid gland. Okay? Any pain with swallowing?
Nope.
Okay. So your trachea is midline. Now I'm going to take this water here, okay? I want you to hold it. Put some in your mouth, and then I'm going to have you swallow. Just so I can palpate your thyroid here. So swallow. Great. So I can feel both sides. There's no enlargement on your thyroid there, okay? There's no polyps. I don't feel anything abnormal. Could you do me a favor? I want you to look down and look up and to the left and the right. Any pain there?
Nope.
Can you move your neck?
Nope.
Okay. So I'm going to palpate your lymph nodes now, okay? So why don't we turn this way? Okay. Just a little bit here. Okay. So your preauricular, your postauricular, your occipital is going to be in the back here. I'm going to do your posterior so I can see this side. Let's turn you this way here. Your posterior, your interior. Look to your right. And your left. Okay, I don't feel any I don't feel any palpable or immovable masses there. Okay, so I just want to check your tonsillar. Look up for me. Look down just a little bit. Okay. And I'm going to check your submandibular, submental, and here we go. Great. Okay. So I just want to have you clench your jaw for me. And again. And I want you to go left to right. Alright, there's a little clicking there. Is that bothersome to you?
No.
No? Okay. And I just want you to look to your left, push against my hand, and push against my hand, and shrug your shoulders up. Okay, great. So I think we've concluded our exam. Other than just one last test I'd like to do. Okay? So this is sharp and this is dull. You tell me what you feel, okay?
Okay. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay. Great. Alright, that concludes our exam, okay, Benjamin?
Okay.
Alright, you call me and let me know if you have any problems or concerns in the future, okay?